Okay, good evening, everybody. We'll give a couple more seconds for everybody to wander into the webinar tonight. Um, I really love this presentation. I am very excited to have this conversation tonight. It's hard for me to believe it, but I'm into my second decade of utilizing Invisalign, and it's been at least the last decade for me taking a deep dive into digital dentistry. So there's something that's near and dear to me. This is Smile Architect. It kind of puts everything together. When I got into digital, it felt a little bit like the Wild West when I started trying to piece together concepts from YouTube videos and trial and error. But the tools that we have now, how user-friendly they are, the resources, how robust it is, and different education sources for us to learn this thing, it is incredible and it gets revamped year after year. Especially over the last several years, I've seen the evolution of digital dentistry dramatically change. Even the rate of change seems only to be speeding up. So before we get started, let me start off with a little bit of housekeeping. While I rarely notice the questions in real time that we're doing these presentations, please, there is a Q&A box. Post your questions as they come up, and I'll be glad to answer all the questions that we have at the end. And secondly, if you've got questions about the Dawson Academy in general, or anything about programs, Dylan is on the back end taking care of all of our IT stuff. He's a great resource. And truthfully, I want to congratulate him. Not only is he babysitting me through tonight's process, but he has just accomplished the impossible, revamping our Dawson Academy website. So please see all of his great work after we're done with the presentation and look at the dawsonacademy.com. There's a ton of new content on there in a really digestible format. So again, kudos to you, Dylan. And some other little bit of housekeeping. Let me also let you know the standard disclaimer that I have with Align being transparent. I am a speaker for Align, including Invisalign and iTero and exocad. So I'm also an independent consultant for them, which means that the views that I present here tonight are reflective of my personal opinions, my beliefs. More importantly, it's just what I'm doing day in and day out here in the practice. I get to use all of these principles of functional occlusion that Peter Dawson left for us, but now I'm using just the coolest tools to enhance and expedite the process without compromising predictability. So, on that note, for those that don't know me already, my name is Andrew Reingold. A lot of people call me Drew, and I live and work here in the heart of Manhattan of New York City. The biggest honor I have in dentistry is simply being a part of the Dawson Academy. It's where I started my advanced dental education, and it literally transformed the trajectory of my career some 20 years ago. I still remember the first aha moments I had sitting at the Trade Winds Hotel. And those moments have only become more remarkable as I now look back to see how successful these concepts are, not just in amazing theory, but literally decades of seeing that dentistry successfully persevere. And specifically utilizing Smile Architect and taking us into the future, let's go over some of the typical objectives I have in talking about it, and then also give you some perspective on now several years of using it. So number one, right off the bat, distinguishing how digital pre-restorative alignment setups may allow for more minimally invasive restorations. To me, that speaks volumes to the logically minded individual. That just makes sense that if I have a design that's set up for ideal aesthetics and function, then it becomes really easy for me to figure out where I want to place the natural teeth within the design to make it as conservative as possible in the preparations. So that just makes sense on a logical level. And the opposite, on the more visual level, that number two, we illustrate the importance of a facially driven treatment plan for ortho restorative setups and the impact on the treatment outcomes. And for those visually minded dentists, patients, or dentists for that matter, that you literally can see where you're going before you're getting started. And using the elements of the face can help dictate where we want these restorative or orthodontic changes to be. And then number three kind of combines aspects of one and two, where we evaluate how the tool may enable doctors to simplify their approach to patient communications, and it creates opportunities for us to improve case acceptance. And this is really at the heart of it, the emotional connection that comes from generating something that logically makes sense based on 3D data set, at the same time gives you a visualization of the before and after, well before anything is initiated, in just the conversation at the beginning. So when you put those things together, people become emotionally invested in knowing that there's true science backing up this cool simulation that they're seeing. And what I've realized now, using this for a couple of years already, is that there's another bigger picture to all of it. And it's having the ability to have one seamless, digital, efficient workflow that is utilizing every aspect of dentistry. It works for every patient and every treatment modality in your office. This is not just about Invisalign or clear aligners for that matter. Yes, I like the fact that we can reposition teeth, but having software that enables us to do all aspects of comprehensive dentistry on one flat panel in front of us, and then be able to move that conversation forward, both on the treatment planning side as well as in the conversation for case acceptance, that's really big. It makes us very efficient and it gives us opportunities that we never had before. So without further ado, let's look at a case so we can really see what that looks like. This is a great case showing integrated digital workflow. This is Guadalupe, a great patient that came to my office and requested a single tooth implant. Sounds simple, right? The oral surgeon referred her over knowing that we were going to listen to her issues, but also spend the time to work through what's best to address her problem. Maybe more important, the root causes of that problem. So she's had a lot of issues with this broken tooth over the years. It happened when she was much younger as a kid, and she's had a whole bunch of dentistry sequentially getting more complicated as the years went by. Initially, she fractured the tooth, got some bonding to repair it. Simple, but that only lasted several years, and she had to get that replaced. Even less time went before the next time it had to get repaired, more bonding. Eventually, the dentist decided that it was happening too frequently. They went to a porcelain veneer. It wasn't very long after that that she had the next issue where that snapped off and she was doing a crown and buildup. You can see where this is going. That actually led to her getting a root canal on the tooth. That failed and had an apicoectomy, which led her to our oral surgeon's office to do the extraction and come to us to help plan the implant afterwards. So not as straightforward because there has to be a reason, a root cause for this failing over and over. But like a lot of patients, that's not the only issue, is the problem at hand, but the other factors that come into the equation. Fees are an issue. Cost can be a problem for everybody, anybody. And there are some people that need this done yesterday, and she definitely falls into that camp too. Guadalupe is awesome. She is actually a singer. She's classically trained. She's performed across the globe. And really, this would be a horrible distraction because this is not actually how she presents to our office. This is the artificial intelligence doing a simulation of what we could do afterwards. This is actually Guadalupe the day that she's coming into our practice. So you can tell, I understand that you want to get this done yesterday. But if I bring this over to Smile Architect, it makes it very easy for me to do things that's not exactly what she wants. It's going to cost more money to start planning this out more comprehensively. It's going to take more time to do it comprehensively. But what she ultimately does want is to feel confident that she's getting this done the right way so that she's done with this project and it doesn't have to be another recurrence of dental emergencies down the road. Here's where this software shines. That not only does it give us this picture, a simulation of what it could look like, but it actually makes the conversation that I need to have with her so seamless because it gives us the typical Invisalign ClinCheck where we can see the cartoon rendering of where her teeth are at. Now you can see the translucent blue image of where that ideal restoration is supposed to be, and we put this all together and get the simulation based on that. It is not just a graphic designer's ideal vision of what a nice looking smile is for this patient. It is literally taking the 3D data from our scanner, putting it into this screen, and taking that imagery and converting it into a photorealistic version in a photograph of her next to it. It's based on reality. And that is a strong message, but it also makes the conversation really easy of why we need to do a little bit more. The issue that she's had over all these years is not just about the top tooth, but the problem being with what's off with the lower tooth. The software enables us to visually see that there is a problem in the occlusion. The rotation of that lower tooth is completely in the way of where the ideal restoration for the upper tooth is supposed to be. And it's very simple to show that if I move the tooth into the right position and create that really nice lower incisal plane, I can build that symmetrical adjacent uh, central incisor the way that she wants it and function for the long haul. She gets it. It's seamless. And because artificial intelligence is driving this, this can be so easy for us to be able to plan. A couple of short lines can have the technician create this ClinCheck for us that we can quickly show to the patient. And literally what I love and what we do at the Dawson Invisalign Essentials workshop is we go through these exercises doing the 3D controls ourselves so that almost instantaneously we can do the ClinCheck for this and create a design from scratch, where you can go ahead and create the restorative option for this patient, change the shape, the size, the dimensions of that, do all the repositioning of teeth to make it as ideal as possible, and take that 3D data and use it for guides for later on, even after the orthodontics, if you so choose to do it. It's not just about the Invisalign, it's about doing the digital smile design. And because it's all digital, it's really effortless to go ahead and create multiple different options for this patient. So as much as we could satisfy the requirement of doing this the least expensive, easiest way for the patient, she might want more ideal aesthetics, and we plan to do multiple teeth with restorations. We could do 10 teeth. We could do the 4 teeth. And we have total control to change the restorative aspects here, just the way we could change all of the positions of the teeth. We can do that with these restorations that we put in here, these translucent blue overlays. It's not about the material that we're going to use, if it's going to be Emax or lithium disilicate. It's just this is the shape that we want for the ideal smile design, or how we modify the shape or position of those as we so choose. And you can create any appearance that we want. What's even more remarkable is that we're working in a digital format, so we have even more opportunities than we've ever had in dentistry. Truthfully, if we're doing Invisalign, which is what we planned on doing, and which is what she totally understood was going to be the best way for her to have the long-lasting result she wanted, having the aligners is really great because it makes it so simple for the pontics in the interim as well. We can literally have the assistants paint in material to create the pontic in all of the aligners. It looks seamless and it's effortless so that she's covered through all that treatment. But it does even more because it takes a couple of weeks to get these aligners manufactured and into our office after we collect the records. There is still a physical component, it's got to be shipped. And in Guadalupe's case, that could have been catastrophic because in the Thursday between when we collected the records and when we were going to have her come back for the delivery of the trays, she called us frantic that Thursday morning, telling us that the flipper that she had been using wasn't that great to start with, but it fractured into a bunch of pieces and it was a mess. And she's freaking out because she is performing at Lincoln Center that night. That is not an easy task for us to go ahead and accomplish. I mean, maybe can jerry rig something, but it would break up our schedule and would change things around for us to come up with something. But we have a digital format, which is not just helping us plan, but it's storing all of the 3D data that's in there in real life. And it, just as much as that 3D data is baked into that flat panel, we can extract it out and do what we want with it. I can take the design of that individual tooth that we're going to be using for our eventual planning of the implant and take it out now and use virtual software to create a virtual flipper for this patient. It gets extracted right out of the software. And so that way we have it on the digital format. We have a 3D printer, which means that we can take that digital format and print it up in the office in no time whatsoever. Literally by lunchtime, she was able to come into the office to pick up this flipper and perform at Lincoln Center that night. I love dentistry, but when you can also wind up being the hero that saves the show, that is a really powerful day. It is an awesome feeling. The patient's incredibly appreciative, and it makes everybody in the office feel like they're a superhero for helping getting everything done and not disruptive at the day that we had planned. This is only getting easier because while we took that information and used a third-party software at the time, we also have exocad that we can use and start to create it. You could take the information and just send that over to the lab and let them do it on their end. But now when you have an iTero, you actually also have access to a version of that same powerful software that the labs use. iTero has an iTero design suite. Anybody that has a restorative subscription with their iTero has access to this new cloud-based version of exocad, or an exocad Lite that I like to call it, where you literally have that same ability for exocad to produce not only model work for your patient, but the files that you need to print onlays and crowns and temporaries. And my personal favorite, that you can instantaneously create these splints, the same kind of Dawson splints that we've been sending to the lab and having to wait weeks to get back, pay hundreds of dollars to have them fabricated, can now be done in this software by your help for pennies on the dollar and in hours and not weeks. It is a complete game changer. For those of you that'll be at Core 7, I'll talk a little bit more about the splints there, but just rest assured, having all of these tools under one umbrella makes the conversation move faster than it ever has been before. The Align digital platform might be the secret sauce for a integrated digital workflow, because all of these individual components not only have to be very good at what they're doing, they have to work well with your team and they have to work well with the other tools along the workflow. If your scanner does a great job of capturing great information, but doesn't talk to your software real well to plan the case out for any modality, then there is a drop off in how efficient you can be. And having smart tools to be able to do a workflow lets you delegate this to so many more of your team members. So it becomes way more efficient, and the ability to have the training much more seamless, faster than ever before. Teaching my team to work a DSLR would take a solid week to really work through some of the idiosyncrasies that people develop trying to lug around that heavier camera. But getting somebody to work on a smartphone that helps you with AI, I'll show you pretty quickly that it makes it pretty simple for anybody to take great digital dental photographs. And the key team member that's there that doesn't really show up on this screen, but it's part of every step along the way, it's in the background, is the artificial intelligence, because it really dictates the flow of how all of the steps will move forward. And what we're seeing right now is great, but I promise you that is just the tip of the iceberg with the artificial intelligence. I'll share some insights of where we're going with this, but again, this is just the beginning. While it's cool to talk about the future of digital dentistry, I think it is pointless to talk about that without having fundamental principles that are timeless. And that's where the Dawson Academy shines, because what Pete left for us from decades earlier is still as important, if not more so now. So many times we talk about how technology is great for things to go faster, but you can screw up things even quicker with the technology if you don't follow these classic principles. And it's what resonates with me, because at the heart of Smile Architect is similar to Invisalign itself, and it's what Pete talked about initially, like in the textbook, where you don't start any kind of comprehensive treatment plan, orthodontics or otherwise, without having a game plan, but more importantly, being able to visualize the end result and all the steps that sequentially lead up to it before you get started. It's not an experiment where we guess along the way, but we have planned it out and it's seamless. And to me, when I started with Invisalign, that's what a ClinCheck looked like. It was all the individual steps laid out in front of me so that on the tooth movement side, I knew where we were going. And now we're having the same conversation on the restorative side. Just as important it is to have the plan, when we don't have that plan, it is a recipe for disaster. And unfortunately, I've seen examples of this over the years. When I first started in dentistry, I was an associated office where I saw this patient where at 6 years old, up in the Bronx, this girl chased her ball into the street and she was hit by a car. Granted, it's great that the only lasting damage physically that she had, that she was lost a central incisor. The emotional baggage that happened for decades afterwards is pretty traumatic because the view of the orthodontist at the time was to fix the space created by just closing up the space. This is missing the forest through the trees. It's not a game plan. This is the orthodontic equivalent of single tooth dentistry. It's not poor planning, it's no plan whatsoever. I wish I could tell you that this is stuff that's just historical from like 20 years ago, but just a couple of years ago, I had another case that's fairly similar where a patient came to my office just the day after having braces removed. And obviously, spaces were created for her, so there was a thought about having a plan for restorations. But we put this quickly into a digital format so that I can evaluate the case and start planning the case pretty quickly. Digital is great for that. And even before I had Smile Architect, I was able to use software, even free software, to be able to visualize and plan. So we brought it over to Mesh Mixer, and we can take libraries of teeth and just cut and paste them. And while I love the artistic side, it's cathartic to be able to spend the time doing a wax up. Time is precious, and the amount of time that we need to spend on doing this can sometimes be prohibitive. So digitally, I cut and paste teeth. Anybody in my office is kind of capable of doing that at this point, especially now with Smile Architect, so that we can put some ideal forms in there to close up the gaps. And that's not just quick and easy, but even faster to mirror that over to the other side. This would take hours for me to do the wax up, but it's minutes for us to do that digitally. Just as importantly, it's easier for us to visualize what's going on. We can change the perspective, literally or figuratively here, and then we can visually see what the problem was. Just a small change in perspective shines the issue that we have. There was no consideration on how conservative we can carry out the restorative aspect of this. We needed to look at this view first, then move the teeth to fit into the restorations that were ideally set up. This is a plan, but it's one that lacked any clear vision where everything should be at the end result of the case. I wish I could tell you that I'm immune to having these problems, but I've done my research as well. I've had my fair share of dropping the ball, and here's a great example of that. This is where I failed on a case presentation standpoint. This is Molly, who had an emergency on a Monday morning where she woke up, the resin restoration on her central incisor broke off. And I hadn't met Molly before. She was a new patient with an emergency, so we brought her in right away for the emergency visit to address the urgent concern. But we're digital, so we can quickly, efficiently also capture records, which is huge. We have time to address maybe the root causes for these problems. She gave us a history of having braces as a teenager, not being very good about wearing the retainers, and having some relapse, shifting of the teeth pretty soon after, and noticing it got worse over the years. She also noticed popping in the jaw joints, some discomfort when opening, complete opening as big as possible, and these are the kinds of signs and symptoms that I treat routinely. It's what I get excited about doing. These yellow joint cases can be awesome. So I got very excited and I wanted to illustrate not only what's going on, but why these things are breaking down and start talking about solutions. Maybe I got a little bit too excited. So I replaced the bonding very quickly, but then I captured a ton of information, first and foremost on our scanner. I really wanted to do this path of co-discovery with her. We get the shape and position of the dentition, but we also can share the signs and symptoms of occlusal instability quickly with our patients at the same time. Like the wear and migration of her teeth, these things really get displayed well when I go to the stone model view. The contrast really points it out. We can also generate a heat map of the occlusal contacts, the proximity of the teeth, and the occlusogram. Point out where there might be traumatic forces. I can even go so far as use a multi-bite feature to record both maximum intercuspation and centric relation, visually showing her that slide between those two positions. These are some things that when I try to verbally describe to patients, if I describe it to dentists, they can get lost, but visually to see this, it just makes sense. When she started to own the problems, I took it a step further. After co-discovery, when she starts to have the interest in what we can do for solutions for those issues that she sees, then we can start talking about what treatment might be a remedy for it. Here's where I dropped the ball. I used Outcome Simulator because at the time I didn't have Outcome Simulator Pro. I could only show her a cartoon rendering of what would change on the repositioning part of this. So that's what I showed her. In my mind, I knew that if I could create a dentition where the teeth are in the right place for a stable occlusion to be set up, where I could do an additive equilibration for centric stops, I can make this look a lot better and function a lot better. And it made logical sense. But I did not get the oh wow reaction that I wanted out of it because what she saw was just moving the teeth that she already sees, and they're not really in harmony with anything when she sees it. It looks like this weird cartoon of teeth. Yeah, she knows that it's hers and she gets the concept, but there was no emotional buy-in. It wasn't looking at her, what she's going to see, what she's going to have other people seeing of her. So I got her to sign up for another visit. I wanted her to be scheduling for an Invisalign to get the process started, but I had to settle for a hygiene visit. I failed because I didn't create any emotional connection to what I was describing, what we can do to solve the problems, and the issues that she had at hand. Fortunately, I knew that I was beta testing Smile Architect within a couple of weeks. I captured all the information that I needed so that I could run that simulation. And when she came in for the hygiene visit, I was well prepared. I started with this part of ClinCheck, which is now Smile Architect showing the photograph of her that day that I met her and the cartoon rendering from the same time. She already saw this. But now I explained how Smile Architect uses her actual 60 plus metrics on her face for ideal smile design. The artificial intelligence is using the reservoir of 17 million plus smiles that they've looked at over the years to generate an ideal digital smile design for her based on not what just looks good, but on the 3D data of her actual teeth repositioned and reshaped appropriately. And when she gets both the logical argument and the visual display, the emotional component comes into play. And she is calling her mom to work out the financial arrangements for that next visit before she leaves, looking at this last slide. And I would be remiss if I tell you this is the only occurrence that this happens. This has really become the norm, and it should be. There was a great study in 2020 that reflects this, where they looked at proportionately 100 cases. General dentists had seen a whole bunch of cases that they were going to do restorative work. They were able to have 5 independent evaluators look at these cases and determine, assess if there was any benefit by doing pre-restorative orthodontics. And they found that 3/4 of those cases would benefit by doing some repositioning before the restorative. We're not talking about Invisalign or clear aligners or any kind of orthodontics. It really didn't matter what modality, just that there was the need or the benefit by doing that repositioning before the restorative. So that sounds good. The sad part is I went a step further to see what actually happened. And out of all those cases that could benefit, there are only about 15 cases where the dentist had the conversations with the patients to move forward with that repositioning. It's a little bit sad because it's not really the onus of responsibility on the patient to know about what benefits there could be by comprehensive dentistry or what options that they have. That's on us. We have to initiate those conversations. We're dropping the ball here. Even sadder is that even having those conversations, fortunately, only 1 out of 100 actually is going to be doing that ortho to start with. And while that might sound a little bit bleak, on our side of this, having the conversations here tonight, having that mindset that we have a very simple digital workflow so that everybody on our team is helping moving this process along to capture all of the complete records that we need to do a complete treatment plan. Well, there's a lot of opportunity to make that move forward very quickly, efficiently, and getting the patients on board and seeing the value for doing so. So let's take a little deeper dive into what this actually looks like. What are the tools that we use to get the job done? The most efficient way is right here. These are 3 digital tools that represent the most efficient way to start a Smile Architect case. Starts with the Invisalign Practice app. A smartphone or an iPad can utilize this app to gather all of the photos that you need. The truly essential photograph to start Smile Architect is literally the one in the middle center box, the wide smile. Let's pause for a second on this because it's a crucial step for everything else that we do. It's like I said before, that we're going to be generating a digital smile design based on a whole bunch of points that are on the patient's face. Over 60 plus points that artificial intelligence will look at, identify, and start to compute how the smile design should be for that individual. Well, it really helps to have the best photograph possible here. I don't actually like the term wide smile because if they exaggerate how wide it's going to be, it's not the sincere, big, and happy smile that I ask my team to get. And truthfully, what I'm really referring to is a Duchenne smile, which is that sincere smile, or as we'll refer to, smiling with the eyes. It's where we're using all of the muscles of the face to invoke that sincere reflection of happiness from the patient. And so when it's genuine, not only does it help the artificial intelligence identify the true stops that they need for digital smile design, but truthfully, when they design that smile, when they reflect it back in that photograph, it's the most pleasant one to show the patient as well. And so if you're going to use it for case acceptance, put your best foot forward. So that's where the practice app will help. And now, if you go a step further, it's easy to use. If you're using an iPhone, this is where people take photographs all the time, and it's a smart application. So it stops you from taking the wrong photographs. It will sense if the patient is too big or too small for each photograph that you're taking, if it's out of alignment or not, and it only gives you the green light for the photograph when it's correct. And that's when it captures it. Invisalign has gone a step further, knowing that many of us have a photo series. The Dawson Academy has got a great photo series, and so we've built in extra placeholders where we can put in the Dawson photo series and have our team put all of those photos in one place, make it cloud-based. You can export this to any of the other apps that we use. If you're using Smile Wizard, you can take it from here and export it over pretty seamlessly. To go a step further, not only does it make it easy having this on an iPhone or an iPad, but the future is where you can convert that device to doing even more. Having another button located in the app where you can literally turn your iPhone or iPad into a 3D face scanner. And so within the app, you'll be able to collect the information of the patient's 3D face, and that is super powerful to start creating a digital avatar of your patient. Because when you have that information, you have the benefit of having articulators that are in the digital world too. Having the intraoral scan merged with the 3D face scan means you have a digital avatar of your patient that you can mount the case in the virtual articulator in a similar fashion to what you would do with a face bow or ear bow in the real world with your patient. But now you can do it on this flat screen in your office or anywhere else on the planet, anywhere you want to at any time by downloading it and working from the cloud. With the virtual articulator, not only do you mount the case, but while it's on the flat screen, you can have the data collected of the three-dimensional movements, how it affects the occlusion and idealize the occlusion so that you can construct any kind of dentistry you want. We can do our full Dawson complete set of records and treatment planning in this digital format. If you're not there yet, you can go ahead and download the files, or you can go ahead and 3D print those files, have the files taken over to your lab and let them 3D print it and work in the physical world still if that's your sweet spot. So you can capture the information digitally, but then convert it because we now have digital transfer adapters so that you could have these files 3D printed, and using these physical adapters, our 3D printed models will snap into place similar to the way that we would use plaster and mount the models to different adapters as well. They fit into our Danars in a very similar fashion so that you just pop and play and do all of the same workflows that we do and all of the exercises through the core curriculum and what you should be doing at home now. But the benefit of going digital is that we have more opportunities and more options. As the artificial intelligence plays into this, the ability to have our 2D analysis and 3D analysis happening simultaneously in the same flat panel window is tremendous. We can streamline our process and be even more efficient in the thorough evaluation we are with our complete records without compromising on predictability because all that information is there, captured in a predictable way, and that we can utilize in the same manner that we do in the physical world. So let's go even deeper into what Smile Architect is all about. We talked about the key component in the beginning about just having that personal visualized patient communication. You get befores and afters well before anything starts. At this point, we don't even need Smile Architect to have that conversation because the scanners are doing this work right there on the screen. At the same time that you're collecting the data, the artificial intelligence is giving you that first draft. And we'll have the 3D controls there that you can manipulate the restorative as well as repositioning aspects of this while the patient's in the chair for the data collection. But what's really powerful with this is that it's not just the visual. The next major benefit, the digital 3D design with an overlay, again, it's not just Photoshop. This is AI for the best aesthetics based on over 60 data points captured for each individual's face. We go into some detail about that later on, but for now, no, it's a great target for where we want to reposition the teeth. If we know the ideal contours and positioning of the final restorations, I have a garage to park the car of natural teeth into for the repositioning part of this set of procedures. It makes it easy. I don't have to guess where I want the teeth to wind up at the end. Additionally, we can bounce back and forth to idealize either the position of the teeth or the shapes of the restoration to create an optimal pre-restorative Invisalign setup. So we can tweak any aspect of this. If we find that we have to prep too much with the ideal positioning of the teeth, we can modify the changes or shapes of the restorations, or we can go ahead and keep the ideal restorations and move the natural dentition so that we're doing less aggressive preparations. We can go a step further. The same type of visual communication we have with the occlusogram can be utilized to visualize a heat map of how close we are with the preparations that we'll have to do for the ideal restorative design. If our placement of the natural tooth is too close to the surface of the restoration, it'll give us the redder marks to let us know that we're impinging on that aspect. So maybe we get rid of the red by repositioning the tooth, or we change the shape of the restoration accordingly. Lastly, what I think might be the most important part of this is that we have the ability to take this information to our laboratory and work with our lab technicians so that we can provide basic information. We have an anterior matrix for every aspect of every contour of all the teeth. Doesn't mean that we have to wax up every tooth ourselves. We can convey the information with just a couple of teeth. If we make the ideal anatomy for upper and central incisor, and we create the perfect centric stop for the that tooth and the opposing tooth below, then I can send those two teeth and their relationship to each other and to the jaw joints over to the lab so they can use exocad, because all this information gets exported in a package and they can finish the job for all the rest of the teeth. And all of this information is absolutely free. Even before you accept the Invisalign treatment, you can export all of the information in these STLs and images so you can work with the labs or your set of colleagues that are on your team for other aspects of dentistry. Take this case where he is complaining about not only this funky bite that he doesn't like the look of, but he can mask that in pictures, but he doesn't like how small his teeth look in these pictures anyway. So he really envisions correcting the configuration in his bite. He has some other signs of occlusal disease, but he also wants to change the shape of the teeth. While I'm not doing any kind of orthodontic surgery, I can use this software to plan almost every aspect of this case. So I can hand the team what I want for the end of this treatment and really the realistic version of where I want every step along the way to be. So they know exactly what I expect to get back for when I want to take over the case. And they can commit to being able to do this or know that if they don't do this, the patient's going back until they get it right. And when the patient hears that, there's a degree of confidence that goes along with all the technology that our team is communicating at a high level to know that everybody is on the same page. And it's great when it's talking about the team, maybe even more important when it's all on your shoulders. Here's a patient with high aesthetic demands. She has a nice smile, but she's always wanted to tweak this so she gets rid of the orthodontic relapse that she has in the lower teeth. Plus, she's never like the discrepancy between the laterals. The shapes are different. There's a little discoloration as well. And she would be open to doing some dentistry if it wasn't very invasive, if it wasn't very cumbersome, and she knew that she was going to really get the results that she would expect out of it. Well, that's really a much easier conversation to have with somebody when they see the level of planning that we do. Because when you build it with the end in mind, you really can deliver seamless results. And it's not about like how talented you are for being able to do this kind of dentistry. Anybody can go ahead and squirt in flowable composite to do injection molding techniques when a digital design has every aspect of this laid out from the get-go. It takes a case like this to this, we're almost independent of the skill set of the actual provider. It's not about talent. It's about just using tools and filling in the lines that are created by the artificial intelligence from the start. So you get a patient that you know is going to be happy with the end results before you even get started. And with that, let me thank everybody here and make sure that I give out my personal information because I have been privileged to have some of the best mentors this planet has ever seen. And I want to be able to pay it back and be that kind of mentor for anybody else that has the questions because these giants have taught me everything that I'm able to do now. And they've been very generous with all of the questions that I've had along the way, and I hope to do the same. I can't promise that I might be able to respond to emails on day one, but give me a couple of days and I am glad to get back to you. And if for those that are really interested in employing all of these concepts of PEATS, these classic principles in functional occlusion, and to do that through a digital format, and to also use Invisalign or clear aligners to be able to handle the repositioning aspect of that part of complete dentistry. I've unfortunately had to do a couple of decades of R&D on troubleshooting through some of these experiences to get where we are now. But in 2 days, I can convey all that information to you. It's an intense couple of days, but we work through these things hands-on to go through the repositioning aspect of this and how we get digital records for complete dentistry. So it follows all of the principles that Pete left for us in this new paradigm.